We will start, Vada, right?
Sounds good.
Yeah. So,
Wonderful.
yeah. Hi, everyone. We are very, very excited to have you here with us today. My name is Taylor Alferi. I guess most of you know me from Ben Gurion University, Israel, and Vada.
Hi, everybody. Welcome. I'm Varda Manfeder, and I'm from the Department of Applied Human Sciences at Concordia in Montreal, Canada. It's great to see you here today.
Yeah, we are very happy to have you with us. I just start with saying that we are recording this session for sharing it through INTRAC website, so it's important to mention that. And we will present, I'm going to share with you what is our plan for the next 1 hour and a half. We will share we will have the presentation, and then we'll have some time for question and discussion. Just give me a second to share. Okay, that's it. Okay, sorry. I will try again. I think it's not in full screen. Oh. Can you see it's like full screen or half of it? It's not
It's not full screen, but it's
right. I'm trying to do why it's going this way. I'll try again. Sorry.
we could see your screen, but we saw the next slide as well.
Yeah,
Tehillah.
yeah, yeah. I get that. Yeah, I get that. What I'm saying you see the same. Sorry. I we should, it's part of the deal with the Zoom to have some technical issues. Okay, let's try now. Now full screen. It's okay.
Perfect. Yep.
Yes,
Okay,
perfect.
great.
Lovely.
So yeah, so welcome to our book launch and webinar about recent innovation in living care insight from the Global South and Global North. We are going to have opening reflection from Varda and myself. Then we will have the country perspective from Dr. Tanya Abu from the University of Hildesheim, Collins. I'm again at War Yarve, sorry, from Macquarie University in Uganda, and Professor Gabriela Dima from Transylvania University of Brasov, Romania. And then we will have some time for discussion and questions. So I'm going to start with a short presentation about the book. So you can see here's the book, and this is a time to see. I see that I got Soldi's here. I got help us through this project. So this is a good time to say thank you for your support. I guess many of you met her during the way. And we will tell you a little bit about the book before we move forward. So the book is a second version of the book from 2008 from INTRAC, and it includes 32 country chapters referring to legislation, policy, research. I will refer to that. It's a big growth compared to the previous book, which included 18 chapters, 18 countries. And here we have a special focus on the Global South with 8 countries from South America and 8 from Africa that were not included in the previous book. And it's part of INTRAC, 20 years effort to foster research and legislation relating to living care. So the main theme in each chapter refer to the background and key statistic relating to children and in and out of care, then a summary of current legislation and policies to support caregivers. We refer to practice and referring to preparation to live in care and support after living care, key recent research from different countries, with some of them could share much more wide research and other only very limited research, and small references to the current status of care leavers, organization, and youth participation. You can see here the list of the countries from the Global South and Global North, and we have one chapter about INTRAC and how INTRAC was developed throughout the years from Professor John Pinkerton. When we try to summarize this very wide book, and of course it is a very challenging task, and I'm not going to do it in the short time that I have, we find that different countries refer to the issue of living care as an issue of social justice, with referring to the barriers that caregivers experience with receiving different rights, sharing the same experience as their peer groups that can stay with the support of their parents after they get to the age of 18. We refer to the issue of consistent marginalization, although we found a lot of cultural differences still around the world. We find this marginalization, and also different countries reported research studies that describe issues of unemployment, homelessness, physical and mental health challenges that caregivers experience in different contexts. A big issue was related in the book to the pretty new idea of extended care policies in different countries, with the global north represent mainly the countries that provide these services. Extended care means that young people stay in care beyond the age of 18, the age of majority in all the countries in our book. Still, the time for this extended care, the ability to stay in care, was between the ages 19 to 21. In most of the countries, there was only a few that refer to possibilities to stay for longer times in specific situations, for example, for young people with disabilities. And Germany represents an option to stay up to the age of 27. We will hear more about this later. Also, we found references to aftercare services with main documented topics or life domains that these services are available. For example, financial support took a big part of what caregiver gets from different countries, from different institutions. Housing assistance, again, was important part to support them after living care. Different services related to education and employment, for example, paying for their tuition, support them during their studies, providing different programs to help them integrate into the world of work, and also emotional support from different types that to support them during the transition from care to independent life. We found, as we can expect, big differences that related to the context. In the global south, there were more residential care and high rate of informal and unreported foster care, limited legislation. Only 5 countries of the 15 countries that have laws, and services often provided by NGOs. In the global north, we found more foster care, and then there is more possibility for extended care, more established legislation. Only Israel and Sweden actually don't have this kind of legislation. Extended care options that available, and more developed research in many of the countries. We refer to the cultural context in terms of the challenges in living care. For example, some of our writers refer to the issue of living care without family ties. In Ghana, for example, it's really important to integrate into employment. The loss of self-identity that is related in collective societies and its unique challenges in these societies, and the issue of entrepreneurship in some of the countries in the global south. Again, from the other side, we know that countries that provide more wider welfare policies, for example, they provide health insurance, they provided cheaper education, they provide support to different marginalized groups, can support caregivers in better way. The issue of education was important in terms of payment and how it can support caregivers in their transition to independent, universal and limited health insurance, and also, and of course, the cultural expectation related to independence. Another issue, or the main challenges that we identified, and of course it's only a few of them, is the issue of limited data. It was very sad to learn that in many countries, even the very basic number of how many caregivers exist in each country, or how many minorities there are in care, or what is the age that they normally live, if they stay until the end, the age of 18, or leave earlier. All of this was not available in different countries, even not only on the global south, also in the global north. The issue of regional inequalities was very clear in some countries. In the global north, there is legislation, but still only in some part of the country, of these countries, people can receive this. And the postcode lottery is a sad term to reflect this, that it's really kind of luck where you live, in which kind of city or area in your country, if you receive services or not, if you receive support or not. Also, the issue of uneven implementation. In some countries, they describe that they have legislation, but there is no really way to implement it. For example, in French, there is preparation to leave care is in the law, but still only a third of the department can provide this. They have the means to provide this preparation. And we identified research gaps in the global south especially, but also in the global north. Some countries as Austria, Canada, Germany, and other countries reported on having very small amount of research, especially when we refer to the issue of longitudinal studies and peer-led studies. And to conclude, in the global north, the implementation gaps refer to inconsistent implementation, while in the global south, it's more related to fewer policies and NGOs that provide the services. But when we try to look at the general picture, we find policy and practice gaps that create vulnerabilities for young people in transition from care. And at this point, I'm going to forward it to Vard.
Apologies, I was muted. So here I come. Okay. And my task right now is to talk briefly, and I hope here's come my slides, talk to you briefly about today and about the background to today's webinar. So the first thing is just to remind us all that INTRAC first came together in 2005. And I want to just acknowledge the really significant our four parents, I would say, Mike Steen, Harriet Ward, and Emily Munro, who really were instrumental in creating INTRAC in 2005. And the group was much, much smaller then. But the purpose was really to pursue knowledge to improve the lives of young people, specifically young people living care. And implicit in that is the idea of influencing policy and practice. Now, one thing, and I'm going to refer you back to John Pinkerton, who's our historian in this book, and I'm quoting him here. He said, "It's generally recognized how really difficult it is to close the gap between research-based understanding and policy and practice." And we can see this also when we look through the book and see what's going on across the world. Very interesting. There was a research team from London that in 2019 came together to think about how researchers can influence policy. And that's because they stated that academics don't really know how to start. As a group, we're not very good at influencing policy. And then, in fact, there are very few studies on what strategies can increase the influence of research on policy and practice. So they went through all of the literature, gray literature, academic literature, policy literature, and summarized. They came up with a list of recommendations for researchers who want to influence policy. So, among their tips, the first thing they mention is it's important to build networks. And of course, here we are. We have this wonderful network. Also important to produce high quality research, which we all do. But two things that I'm not sure we do consistently that they recommend is the importance of becoming intentional in relation to advocacy and also in reflecting on, on your activities as a researcher and the ways in which the research can be used to influence policy. So, from the beginning, going back. From the beginning, INTRAC really promoted the dissemination of information about individual countries, about specific policies and practices. And so initially there was a lot of sharing, and still is today, a lot of sharing about what goes on in different countries around the world. Springing from that, there were opportunities to engage in comparative research. We know that by now there's been a handful of studies really comparing different countries around the world. The second thing really that's been important in INTRAC is some members really have built on the data from other countries to advocate for change locally. And people often come, especially now, to global INTRAC meetings to try to hear about what's going on elsewhere so they can take it back to their country. And so, for example, I was involved in writing a policy brief for the federal government in Canada to try to shame them into creating national legislation. And that was really inspired by the examples of my INTRAC colleagues. The last thing is this book, Leaving Care Around the World, because we have so many more countries and we have both global North and global South countries represented, it's really provided us with a new opportunity to observe international trends and also reflect on our activities. And so that's one of our hopes for today, is that this will create some reflection. Now, sorry. Now, oh, goodness me. A very significant observation from the book, and I got to move this, sorry, from the book is that if you read through these 32 countries chapters, you'll see that in some countries, innovation is increasing and conditions for youth leaving care are improving very rapidly. And one of the things I think that's very important, and this is where I've been using some of this data in Canada, is that the countries where innovation is happening are not necessarily the richest countries, nor is innovation restricted to the global north. So we learned a lot just from that observation. And so what is our hope here today? I don't know if you can see this. And you see that your faces are covering the PowerPoint. Yeah. Our hope for today is really to go beyond reporting about what's going on in different countries, but to consider where innovation is happening, and more importantly, to reflect on how it is happening. And so we've asked our guest speakers today to address that. As Tahila mentioned, we're going to ask you to keep your questions for the end. And we're hoping also that this might give you an opportunity to share with us some innovation that's happening in your part of the world. So I'm going to stop here.
Thank you, Varda. And we are going to listen now to Dr. Tanya Abu from the University of Hildesheim, Germany.
Thank you so much. Tanya wishes to be a doctor, but is still working on it.
Okay. Sorry,
I would love to.
You will be there very soon.
I'll get there. I'm working on it, but it would be wrong to take the title. Yeah, thank you for having me. While I open my presentation, I also have to thank my co-authors. who are Dorothee Kochskemper, Professor Dr. Schröer and Wolfgang Schröer and Severin Thomas, all from the University of Hildesheim, who wrote that chapter with me. And I'll give a quick overview of recent innovations in living care in Germany linked to the Child and Youth Strengthening Act. So whenever you read the abbreviation KGSG, it means the name of the legislation in Germany. It's like Child and Youth Strengthening Act. And I have promised to not make this a history lecture. So I'll just drop one sentence about the history of child and youth legislation in Germany, and that the 2021 reform was a major reform step, and but we have to also name the Heimrevolte, which was the residential care revolt in the 1970s, which reminds us that care experienced young people have long been active agents in pushing for rights and accountability. You can ask me all about that later in the Q&A. But now let me get into the current legal framework. And the big shift in the legislation is that for a long time, support after 18 existed in law, but in practice, it often depended on the local youth and welfare office. So it was uneven and case by case. And since 2021, the aim is to make leaving care more rights-based, more binding, and more reliable. And I'll start with a few slides on the current situation so you know what the situation in Germany is, and then I'll go to the innovations. The legal basis is the Social Code Book 8, SGB 8, usually translated as the Child and Youth Welfare Act. And the two main out-of-home care settings are foster care under Section 33 and residential care or assisted living under Section 34. And contrary to what Tahila said in the beginning, in Germany, residential care is more prevalent than foster care. Support, as in many countries. Hi! Welcome to the academic circle, young person. So support usually runs up to 21, and in justified cases, and I put that in, how do you call these? In quotation marks, because I think it should not be justified, and it's always a long discussion. It is an innovation that young people can stay in care, but there are conditions under which young people can stay in the system up to 27. An important detail for living care from 18 is that young people have to apply for support themselves. It doesn't simply continue automatically. Before the reform, there were three recurring problems. First, post-18 support was not implemented consistently. Young people still had to argue their case, and decisions varied a lot locally. Second, many endings were unplanned, so young people left without preparation or a clear next step. And third, aftercare often existed only as a small project, not as a stable infrastructure. And on top of that, Germany has had limited national data on care leavers' outcomes, so the system couldn't really learn at a scale. Just to give you some numbers, 210,000 young people were in care, like approximately in 2021, and 300,000 in foster care, 122,700 in residential care. And the average duration in foster care is much longer than residential care, and the exits or living care usually was around the age of 18 or 19. The innovation that, like the first innovation that I want to present is the overall direction of the KGSG. It clearly frames youth welfare around self-determination and social participation. So leaving care is not just the placement ends, but it's a transition to where the system is responsible for supporting. It may sound abstract, but it's important. It changes what success should mean, not only stability in care, but also realistic pathways after care. The second innovation would be a major concrete change in the entitlement under Section 41 in the Child and Youth Social Act, where support for young adults should be granted as a rule until 21 and in justified cases, as we just talked about, up to 27. And the aim is to move away from the old 18 equals the end logic. And this is also about realism. Education, vocational training, and housing stability rarely fall into place exactly as at the age of 18, which probably all of us in this virtual room know. The third innovation, which is huge, is the coming back option, where young people can return to support if they need it after leaving care. And it's huge because transitions are not linear and things can go wrong. And this is actually acknowledging that life is not from A to B and that things actually, especially as a young person, can go wrong, and that a crisis after leaving care shouldn't mean you're permanently on your own. The fourth innovation is mandatory transition planning, which means that welfare officers are required to do timely and binding transition planning and to coordinate with other systems like housing, benefits, health, education, and employment services. And this is important because leaving care outcomes depend on these systems. So the innovation here is less handover and hope and more planned coordination, because a lot of times young people fall between the cracks between different systems, and this should help to have a planned transition. And as I already said, is that aftercare should become legally binding, and that is the most tangible innovation in the reform, and that aftercare is legally anchored and youth welfare is obliged to actively provide it. So care services have to actively check in with the young person. Before, some places had aftercare alumni settings or contact points, but often it depended on committed individuals and short-term funding. And now there's a legal basis to scale models like short support packages after exit, mobile outreach in the young person's home, or local care leaver hubs, similar to the ones in the UK. Still not as fantastic as in the UK, and that is my probably personal opinion because I visited care leaver hubs in the UK, but we're aiming in this direction. And a further innovation is about recognizing diversity and marginalization more explicitly in the law under the Section 9 in the book. Services should consider different life situations and work to reduce disadvantages and promote equality. And the reform explicitly names trans, inter, and non-binary young people alongside girls and boys. This matters in leaving care because some groups face compounded risks, for example, unaccompanied minors, navigating both youth welfare and residence law, and queer youth who may not have supportive family networks, as most care leavers. The Last innovation I want to present concerning the law is that the reform also strengthens rights infrastructure. There must be complaint procedures and structures for feedback, also relevant for foster care contexts. And there are mandatory ombudsperson services, so young people can get independent advice and mediation if conflicts arise. Participation is strengthened too. Youth welfare should involve self-advocacy and self-help organizations. And one very practical change is since 2023, young people no longer have to pay income-based cost contributions for placements, so less financial pressure right at the start of adulthood. And this probably needs a sentence of explanation because before 2023, young people in care had to give away parts of their income to the state. Like they had to pay for their placement, and this was like a 10-year fight to abolish this rule, and that young people do not have to pay for basically their placement anymore. Regarding to what Varda just said in terms of like how do we work together towards change also with policymakers, there is a growing leaving care infrastructure. Germany has seen more local projects, networks, and contact points for care leavers. The Care Leaver e.V., which is the Care Leaver Association, is the key national self-organization, and they're very present as well as research projects as in policymaking, and there's like direct links and working together towards a better situation for care leavers in Germany. And on the research side, the Care Leaver Statistic longitudinal study started in 2021, aiming for representative data on participation outcomes like housing, education, work, health, and finances. And that's important because without data, it's hard to know if reform actually changed lives. We can talk about that study later because I work at Care Leaver Statistics as well. To conclude all those achievements, Germany has made substantial innovation since 2021. Stronger entitlements, legally anchored aftercare, the coming back option, mandatory transition planning, stronger rights infrastructure, and a clearer mandate on participation and equality. But the big issue is still implementation. Youth welfare is local, so practice and resources differ a lot across municipalities. So the next step is to turn these legal innovations into consistent standards and accessible services everywhere. And there's also an ongoing debate about whether Germany needs a clearer cross-system legal status of leaving care, which is similar to the protected characteristic in the UK, but that is something that we are still working on. And with that, I thank you for your attention, and I'm happy to discuss later.
Thank you so much, Tanya. I like the yeah. We should send that too. And we are moving to Collins Atuarve from Macquarie University, Uganda.
Thank you so much for having me here today. It's really a pleasure. And I'll be talking about Uganda. Can you confirm that you see my screen?
We see your screen. You just have to go to full screen.
Yeah. Right, so this is it. Living care in Uganda. And my name is Collins. I'm from Makerere University, School of Social Work. So the context and the challenges. Uganda is in East Africa, and it's a landlocked country, and it's one of the countries with a very youthful population. And it is at about 56% of Uganda's population that is below age 18. And it is true that about 40,000 to 50,000 of the children in Uganda are in residential care. And over 64% of those in residential care have either one or both parents alive. It is it is a challenge in a way that sometimes even the children that are in care have close family ties, but when it is time for them uh, to rejoin their families after care, it is challenging because of what I've listed below as the challenges. There is always a lot of prevention of separation of children from families. It is low, the rate at which the separation is prevented, in a way that when children go into residential care, they get less time to meet and bond with their families, even in instances where they could be total orphans and do not have a parent or alive, or a parent, one of their parents or both of them could be dead. But even the ones that are like the relatives, because the system here is more based on kinship, people that take care of you, they might not be so willing to join in and keep close. So it becomes a challenge at the time when children are supposed to reintegrate. Then there is a lack of commitment and funding from the government. There is nothing special that has been put in place for caregivers specifically. If you look at the policy trends, you realize that everything about the youth is overly generalized. The programs that are in place to cater for youths generally are the ones that caregivers are more likely to benefit from. So there is no special targeting, and that commitment therefore lacks. Then I also like to say that there is no special legislation for caregivers. If you look at our chapter that we wrote about Uganda in the book, you find that most of the legislation that is there is generally about maybe being in care, but they do not specify about what happens when someone is transitioning. So the transition stage seems to lack that utmost attention that it requires. And then here I have the overview of the innovations that have been in place. And first is Uganda now has a Caregivers Association, and the Association of Caregivers in Uganda, ACLU. It has only been in place for 10 years now. So is one could actually say that it is a recent innovation. And it was established in 2016. And up to now, it has over 500 members. So if you compare the rate at which, if you compare the number of children that I said are in care, about 40,000 to 50,000, and then you look at the membership of the Caregivers Network, you realize that there is a gap still left a little bit, that even those that have left care have not joined, and they tend to stay on their own and struggle alone, while this caregivers network is in place, but it has not yet been so popularized for everyone to access. And what the Caregivers Network does, it looks at practical support. It has mainly volunteers that assist in skilling caregivers to make them be financially independent. There's also a lot of support offered that is mental health support, counseling, guidance, and still a lot of it is on basis of the volunteers that are signed up to the Care Leavers Network. It's mostly composed of a team that is led by people that have experienced care before and now are supporting others, but are also doing something to make sure that to bring to attention to all stakeholders what needs to be done about the status of care leavers in Uganda. Then two, there have been some policy reforms. Yes, it is not all just too bad. Of course, you could target care leavers at the stage when they are still in care. So you start to prepare them for the transition. But also there is work to do after they have transitioned. So mostly the policy reforms that we have in Uganda are at the care stage. They are trying to prepare people, but those that are still in care. And we have this National Action Plan on Alternative Care for Children. There is a tendency, that there is a suggestion within it that tries to put children out of institutions. This that has been called the deinstitutionalization. So when you try to make sure the children are out of institutions, it means that you're trying to make sure they have some sort of permanent care. If children are out of institutions and they are within families, and then that means that they will have extra support when they turn 18, because children within families tend to get that more time of support from the families within which they have been placed. Then NGOs, also amongst the innovations that are in place are those that are run by non-governmental organizations. And these have been the most active ones. They've been the most active players in skilling the youth, and some of them do pay rent. They offer some money for rent to the care leavers before they can fully be independent. So they support them to rent out a place, and then as they organize themselves to fully become independent. And then some of the organizations have made sure that children remain with ties with their families while they are still in care. They're in constant communication with their families, and therefore they're able to reintegrate easily when the time comes for them to transfer out of care. Then also, the NGOs have been great in doing advocacy, bringing to light what has to be done about the status of care leavers and advocating for their rights. And then lastly, some NGOs actually go ahead to provide temporary residence within their premises as they skill the youth, but until age 24. So as they train them on how to make money, how to be economically free and independent, they give them also a place to stay. So one of the things that is outstanding about the status of care leavers in Uganda is that it is really rooted in research. I'd love to mention that the Association of Care Leavers that I've told you about earlier in the introduction is an outcome of research. It was a research project that tried to understand the experience of care leavers within Uganda. And this project was the Uganda Care Leavers in 2016. So after assessing and looking at what the challenges were, this research project then gave birth to the formation of the Association of Care Leavers. And then I also like to talk about the collaborations that are in place. The Association of Care Leavers in Uganda is collaborating within the country, but also at the continental level, but also it goes global. So there are all these other partners that keep reinforcing it with support and helping the team to be better, to skill them as well. and they are helping them to become more digital and promote themselves online by giving them all this necessary support that is needed for right now. So briefly, these are the recommendations that came up, also suggested by the association itself, the Association of Caregivers. There is need to make the community more involved in supporting this reintegration, because there is a tendency for community to reject reintegration when children are brought back after care. They fail to fit in within the communities if the communities are not ready to receive them back. Then more vocational training to make them more skill oriented and to make them create their own businesses and jobs. There is need for more policy advocacy, because we need to have those policies or at least plans or that focus or that target the caregivers specifically. And then also we need some multi-sectoral collaborations. So thank you, and that was it from me and about Uganda.
Thank you so much, Collins. Thank you for your presentation. And we are moving to the last one before the discussion. And you see there are a lot of gesture. Thank you for your presentation. Collins, can you take the presentation down? And we have Gabriela Dima. She's from Transylvania University of Brașov, Romania.
Hello, everybody. Good afternoon. Thank you, Tehila and Varda, for inviting me to present about Romania's changes and innovations. I try to put my slides on. Okay. Please, first of all, I want to thank also my collaborator, Daniela Tarnowski, whom I have written the chapter for this book. She's also online and will be happy probably to answer to your questions. Sorry for this delay. I try to add my presentation. Which I sent to you also, Tehila, sorry.
I see. So if it's not,
Yes.
should I share it? I will. Okay.
I hope it works now.
Yeah.
Yes.
Oh,
Great.
Great.
Can you see it?
Yeah, not on. Oh, great. Thank you.
Okay. So just a little bit of context about Romania, some key data, and just one slide on the historical background. Just to have a context, in Romania are 19 million people and the child population is about 3.65 million. At high risk of poverty and social exclusion, with a high risk of 40% compared to the EU rate of 24%. This was in 2023. Hopefully it's not as bad anymore, but still. Children and young people included in this are included in this high risk of poverty and social exclusion. Within the child protection system, we have about 34,000 children, and there are much more of them at this stage in family care, but only about a quarter are in residential care, which is completely which has completely changed from the end of communism, when most were in residential care. So this is a big change in Romania's child protection system. If we try to map the children within the system, they are poor data, but it looks like Roma children are a little bit more represented, and children with disabilities too. As regards young people preparing for and leaving care, I think it's important to see that the age group of 14 to 17 years old are now the highest group represented in care, about 50%. So they will put pressure in the coming years, on the aftercare system. About our historical and social background, for sure, the end of communism is the key milestone, and the EU accession of Romania in 2007, while the key reform directions since were the institutionalization, the closure of large institutions, which almost finished by now, the development of family-based care, and as you have seen, most children are placed in families and professional foster care, and the expansion of the professional foster care. We have some milestones when we talk about legislation. After the end of communism, we had the ratification of the UN Convention immediately in the following year. But only 7 years later, the first child protection reform, with great emphasis on children in care, while caregivers were largely ignored by that time. We have documented more about this in the first chapter of the book, Living Care Around the World, which I have written with Roxana Angel. Which was the good thing about care leaving was this provision that they are allowed to stay in care up to the age of 26 if in education. Unfortunately, very few of them continue education as long. The second major childcare reform in 2004 had brought major changes, and has also put more emphasis on the living care population, with extended care after the age of 18 to 20 years, but upon request. Unfortunately, many young people didn't know they have this right, and it was applied differentiatedly. Another important change which has led to improved aftercare support was the development of the services for independent living skills. And I think that one of the drivers of innovation are these services, even though the implementation of this has had gaps. I think that the emphasis on developing life skills is one key innovation in our reform. And the last 2022 legislation has brought improved support for caregivers, mainly with a preparation which should be 1 year before discharge, by finding active support in finding housing and employment, which is very welcomed and needed, and financial allowance, which is given only to those young people who decide to leave the system at 18, but continue education or have a job. So they don't want to stay in care but continue education. They would be allowed to stay in care until age 26 if continuing education. But this legislation brings this substantial support of 570 euro per month only if they prove that they are in education or have a job. There is an important gap to mention. If they lose their job or have a gap in education, they are not allowed, they lose this support and they are not allowed to reapply for it. So it's only one time they can receive this support. Another important support comes for the post-exit monitoring. It is the first time when within the legislation it's included a monitoring time of 2 years. However, young people have to give their written consent. And some recent statistics shows that in the last 3 years since this is out, only 15% of young people accepted to be monitored, while the refusal is usually motivated by their in-care negative experiences or desire for freedom or lack of information about it. You will see later that one missing piece in Romania is this monitoring of care leavers' outcomes. Even those who have, I will say, improved legislation compared to other countries, there is no monitoring, so we don't know exactly what benefits of this, how this legislation is implemented. Just to point some additional innovations in the care leaver support, actually, I think housing support is one important piece, as housing is their highest need and their highest fear, housing instability. We have some transition centers, quite a few, I will say about 29, and social apartments expanded, but they cannot cover the needs of the big numbers of care leavers. They assure a gradual transition to independence, and yes, it looks like young people who are benefiting from staying in social apartments are better prepared for life after care. Some multifunctional centers appear in documents, however, very, very few. The independent living skills services, developing practical skills and employment skills are also an important asset for the young people. However, the way these skills are developed vary between municipalities, vary a lot. One important support is coming from the EU-funded projects. It's the first line of projects designed specifically for supporting care leaving, were the projects in 2019, the first room projects, offering integrated services, housing, independent living skills, training, mentoring, psychological and vocational support, and there were quite some thousands of young people supported through these projects. And in 2025, there is a second wave of such projects. About 7,000 young people will be supported through this project. So I would say that drivers of innovation in Romania are the NGO sector, as NGOs have developed a lot of, have have complemented and worked in this area of supporting young people before leaving care and after leaving care, mainly providing independent living skills training or housing alternatives and other support. And the European projects I have just mentioned. I would say also it is growing the voice and the role of caregivers and their associations. They increasingly play an active role in advocacy and policy change, as several organizations founded by former caregivers promote their rights. Most active now is the Council of Institutionalized Youth since 2016. Youth participation in decision making is also growing in Romania as a strategy. It looks like the National Strategy for the Protection and Promotion of Children's Rights involved a number of young people from diverse organizations, including young people from care. But yes, it's still room to grow. It feels like quite at the beginning, even though there are 10 years since former caregivers are active players in the field. Research shows that many young people in care are still insufficiently consulted in decisions affecting them. So participation remains still work in progress. Related to research, I'm comparing to what my colleague before, Atuni from Uganda, said that research was a key driver of innovation. I would say that in Romania wasn't like that. Research is increasing, but still limited on care living. We have a single large-scale national study in 2020, which shows some of caregiver outcomes, but the big lack is the post-care monitoring, and that's why caregiver outcomes are largely unknown. The lessons learned are that there is an implementation gap there is legislative progress for sure, but not always effective implementation on the ground. There is a regional variation as services for caregivers vary significantly between regions across Romania. Early preparation is been done more systematically by the services for independent living skills and training. And we see how essential is our housing provisions for a smoother and successful transition. As key conclusions, I would say that Romania has made real legislative progress, that key drivers of change are the civil society and EU funding, and the growing voice of caregiver activists, while the most critical part are data and monitoring of young people. Caregivers are visible in legislative measures, in national strategies, in discourses, but they are invisible in statistics. So without a systematic tracking of outcomes, it is impossible to know whether reforms are truly working. I think I will wait for questions when the time comes. Thank you for now.
Okay, thank you so much, Ella. And see lots of applause there. And thank you as well to Tanya and Collins. I am having trouble with my video. And at this point, we have quite a bit of time for questions and comments. So we would welcome any questions of our three speakers, but we also would be interested in hearing from you about innovations in your own